Currently, the people who are at high risk for developing type 2 diabetes include people who have either impaired glucose tolerance, impaired fasting glucose, or metabolic syndrome. These are all independent risk factors. So the current recommendations for management to prevent progression to type 2 diabetes are predominantly changes in lifestyle. And these focus on weight reduction if one is obese, particularly reducing intra-abdominal obesity, central obesity, and increasing physical activity. The preventive trials that have been done, such as the Diabetes Prevention Program, have really focused on a 7 to 10% reduction in body weight and increasing physical activity using moderate intensity activity, at least a half an hour a day for 5 or more days a week. We had a consensus development conference this past summer under the auspices of the American Association of Clinical Endocrinology and have recently published a new recommendation for how to manage this very high risk group of people. And for the first time have really raised the possibility of using medications such as metformin in the pre-diabetic state. There's also discussion of other medications, including the thiazolidinediones, alpha-glucosidase inhibitors, other medications that have been shown in people with prediabetes to actually reduce the risk of progression. However, one has to look at the risks and benefits of the different classes of medication. And the current recommendation of that group is that the safest effective medication is metformin. This is also the first medication that's recommended for treating type 2 diabetes. So it fits in the spectrum of going from impaired glucose metabolism to diabetes.